Welcome to this special edition of Cronkite News. I'm Sonny Scott. Tonight, we renew our commitment to deliver in-depth, insightful coverage of Arizona issues with a look back at some of our top stories from the Cronkite News investigative team.
We often hear reports about children in the foster care system in Arizona.
But Julia, what happens when these kids become adults? Cronkite News investigative reporter Sydney Glenn is taking an in-depth look at the outcomes.
According to the Arizona Department of Child Safety, as of April, more than 500 young adults has chosen to stay in the foster care system through its independent living program, where they can remain until they're 21. At the age of 18, they have that choice. Either way, the road to independence is a difficult one. Jacqueline Cedillo, just 18, is one of those cases. She's part of DCS's independent living program. But a few short months ago, she was living in a park.
We had to sleep at the park because we couldn't afford the next days for the motel, and so then I ended up donating plasma just to go pay for the next days.
Though she was getting about $700 a month from the state, she didn't know how to make it work. Claudia Torres, Cedillo's mentor from a nonprofit agency in Phoenix, says managing money can be difficult, much less for a foster teen with a 5-year-old child of her own.
That money could be going to rent, but it's going towards that new pair of shoes or those really nice jeans that perhaps are not necessary, but teenagers.
People in this program are required to meet with their DCS case manager like Pamela Harris every month, where hopefully they're learning how to lead a successful life.
So we really have to help them understand money doesn't grow on trees, this is what you get.
In order to be part of DCS's independent living program, people like Cedillo must either be in school or working. But foster care children have greater risks as they reach adulthood. As of April, 345 foster youth decide to exit the system and fend for themselves.
One walking down here on Frontage Avenue on I-17, and he didn't look homeless, so I don't think he was homeless, but you know that he's just not where he should be.
Tanya Stout, a professor of social work at ASU, says some youth that age out have the best of intentions, but just don't know how to follow through.
If the young adult exits from foster care and they don't stay in the system, who's going to help them find the money to take a GED, find a place to take the GED, find the prep courses to do the GED, and then if someone does help them to do all that, actually be able to do it.
According to a report by the Jim Casey Youth Opportunities Initiative, only 58% of children in foster care will graduate high school by the age of 19, compared to the 87% of all 19-year-olds.
I didn't complete high school. I think the last grade I completed was 10.
Pete Hirschberger is part of the Foster Ed Initiative to help better the education outcomes of foster youth in Arizona.
Unfortunately, not much is working for foster children in Arizona. These children fall through the cracks. They are the unwanted children in our educational system, and their outcomes are very poor.
But for Cedillo, she hopes to be a nurse one day and is working towards her GED.
I think about, do I want to be on the street? Or do I want a place to stay? So working in school is one of the most important things in my life right now.
Little is known about what happens when teens leave the system for good. Arizona, like many states, relies on a national database for information with only about a 50% response rate. From that, we do know they are at greater risk for things like incarceration, homelessness, substance abuse, and unemployment. In 2016, DCS does plan to spend $3.5 million on the independent living program. For a full multimedia report on aging out of foster care, including a link to learn more about the DCS independent living program, head to cronkitenews.azpbs.org. With the investigative team, I'm Sydney Glenn, Cronkite News.
With Pope Francis bringing a message of helping the poor, our investigative team is looking into impoverished areas here in Arizona. Cronkite News reporter Sonny Scott takes an in-depth look at one of the communities in the valley coping with chronic poverty.
According to the National Center for Children in Poverty, about 400,000 children in Arizona live in poverty. That's about 26% of all kids. But in the small town of Guadalupe, nearly half of them live below the poverty line. And our investigation found it's not only about being poor, but also finding a way out. From the luxury landscape of the Arizona Grand Resort and its finely landscaped golf course, you can see the town of Guadalupe, one of the poorest communities in Arizona. Its houses run down, some made out of adobe, plywood, or just plain straw siding. For more than a century, Guadalupe has been the homestead for the Yaqui tribe and other Hispanics. Nearly all of them are persistently poor. David Verdugo has been in Guadalupe all his life and lives with his grandmother. Poverty is all he knows.
I just thought it was normal. Until I started growing up and realizing, oh, we're poor.
Verdugo is part of a youth group program to connect kids back to their culture and makes them less likely to get involved with drugs or alcohol. According to the U.S. Census Bureau, 31% of the estimated 6,000 people in Guadalupe are living below the poverty line.
Poverty, though, is so vicious that it doesn't allow people sometimes to get out from under its thumb. And people sometimes get so worn down they don't even see the possibilities of how to escape poverty.
Garcia says half of Arizonans living below the poverty line are Latino, and many won't achieve a high school or college education. Having a higher education is a difficult challenge here in Guadalupe. 53.9% of the people have a high school education, but only 5.3% have a bachelor's degree or higher.
And Arizona is going to drop to a second or third tier state, and it could be on a permanent basis if we don't correct it. Education is the great equalizer when you come out of poverty.
Marina Gonzalez started an after-school program because parents wanted educational tutoring.
Over half of the kids in Guadalupe will not graduate high school, and our goal is to make sure every kid in our program graduates.
She says it's difficult to keep students in school and keep them focused.
Education is one big problem. A lot of our kids are below grade level.
At Frank Elementary, the only school in the town, nearly 90% of the students qualify for free or reduced lunch, and their first language is Spanish.
If they don't close the gap early, by the time they get to high school, they're very frustrated, and they tend to drop out.
Anita Soto helps out at a local youth group program that tells a different story about this isolated community.
But you gotta see beyond the dilapidated houses, beyond the little stores. You gotta see the in-depth, our heart. Look at our heart.
She says the town stays connected through their culture and faith.
Guadalupe is blessed, and the definition of blessed is empowered to prosper.
Verdugo wants to go to college and become a football player, but caring for his grandmother is his full-time job now.
She's everything. She's my inspiration.
Verdugo believes one day soon he will leave Guadalupe and start a life of his own.
You guys just seem like so happy. I want to be like that, experience that kind of happy.
Unemployment and reliance on welfare also creates strain financially in areas like Guadalupe, since the state is hard-pressed to pay for new programs. That's leading some millennials growing up in poverty to look at life differently and the possibility of moving away from places like Guadalupe and getting better jobs. With the investigative team, I'm Sonny Scott, Cronkite News.
Recent budget cuts in Arizona mean some financial assistance programs will be significantly scaled back. Investigative reporter Sydney Glenn explored how that will affect families who need the money the most.
The federal limit for TANF benefits, known as temporary assistance for needy families, is 5 years. In 2010, Arizona reduced that to 36 months. In 2011, 24 months. And come this summer, there will be a 12-month lifetime limit, the most restrictive in the country.
Families seek help from places like St. Mary's Food Bank when times are tough. Many are receiving monthly stipends from TANF, but come July, about half of those people will be dropped. Yesenia Yavano has 4 children. Her youngest is just 2. She says she's nervous about how she'll make up for the lost money.
It's out good with the bills and everything.
In order to receive TANF benefits, people must have dependent children, be considered a needy family, enroll in the jobs program, and make sure their children are immunized and in school. Tom Riley with the Morrison Institute recently did a study on the cuts. The blue bars in this graph show how direct help to needy families has decreased since 1998.
So over the years, the state has reduced the amount a family can receive, and it also reduced the lifetime limit.
Cynthia Zwick with the Arizona Community Action Association fears that people won't be ready when the money stops.
They're going to need help with shelter, they're going to need help with food, they're going to need help with rent and utility assistance.
The Department of Economic Security estimates that when this new policy goes into effect come July, roughly 1,600 cases will be dropped, which could result in more families relying on places like here at St. Mary's Food Bank, where they already provide enough food for 250,000 meals a day.
Karen McLaughlin with the Children's Action Alliance said for some families 12 months may be enough, but not for all.
But there are other families that face multiple issues. If they're homeless, if they're victims of domestic violence, if they have children who have disabilities or other issues, or they themselves have disabilities, it takes a longer period of time to get those issues dealt with and help that family find a job.
The average family receives $195 a month, but needy families may not be the only ones that need to prepare.
It's not an increase in the number of resources available for them, so it's a strain on the community that is always asked to help through contributions of food, through the support of nonprofit organizations.
One of the main goals of TANF is to get poor families off of government assistance and in a sustainable career. But McLaughlin is concerned that that's just not happening.
And we don't think that anything is being done to help the parents get a job that will sustain their family for the rest of the child's life. And I think that's what the TANF program was intended to do when it first was created.
This summer will bring big changes for families on TANF.
You know, one thing I know about these families is they're resilient and they will work as hard as they can to make ends meet in the meantime.
According to the Economic Department of Security, this new policy will save the state about $4 million a year from the $9.1 billion budget. For a full multimedia report, visit cronkitenews.azpbs.org. With the investigative team, I'm Sydney Glenn, Cronkite News.
Cronkite News analyzed emergency room admissions across the state and found nearly 12,000 drug users OD'd between 2009 and 2013. Cronkite News reporter Jesse Schultz joins us with an in-depth look at the data. Jesse?
Earlier this year, Cronkite News documented the epidemic of heroin use in Arizona, an addiction that often starts with the misuse of prescription pills and other drugs. Officials hope that this money from the CDC will pay for new ways to fight this growing problem.
But, you know, if a doctor just sends you out of the hospital or his office with 60 Percocets, an addict's just going to take them constantly until they're gone, and then now they're really hooked.
For those addicted to prescription drugs, overdoses and relapses are just a normal part of life. Cronkite News found that from 2009 to 2013, almost 12,000 drug users were taken to Arizona emergency rooms because of drug overdoses involving prescription drugs, heroin, and methadone. While not all of those are fatal, the number is alarming. Banner Poison and Drug Center Information Outreach Specialist Maureen Rowland said that many of the calls to their helpline are about drugs.
A lot of the calls we get are kind of accidental misuse of opioids. And then we do get the overdoses too, and those are intentional or unintentional overdoses.
And some of those problems begin with doctor prescriptions.
We do see that people are being prescribed it younger and younger, and often unnecessarily.
The CDC recognized the growing epidemic, and Arizona was one of 16 states chosen to receive money to tackle prescription drug misuse. The money will be handled by the Arizona Department of Health Services. The DEA's special agent in charge, Douglas Coleman, said money like this is needed for education.
Kids are going to get what they can get, so we have to educate everybody about what the problems are.
The Arizona Department of Health Services did not return our calls to tell us where the money would be specifically used. In the broadcast center, Jesse Schultz, Cronkite News.
Today, Governor Doug Ducey kicked off National Red Ribbon Week with an event to raise awareness about substance abuse and addiction in Arizona.
The front lawn of the state capitol was packed with people to hear the heartfelt stories of Arizona residents overcoming drug addiction.
My name is Peggy Bays, and I'm the mother of a recovering addict.
Hosted by the Governor's Office of Youth, Faith, and Family, heroin was on the front line of the conversation. Matt Lindgren and his wife both are recovering heroin addicts.
She's basically my best friend, and what I did, she did. So we both got addicted together.
Lindgren shared his story with the crowd and talked about his failures, including the loss of his children to child safety officials.
It led up to losing our kids from just neglecting our bills, neglecting our household. We've always taken care of our children, but we weren't as good as parents as we could have been.
Today, many of the people who start using heroin come from stable families and a variety of backgrounds.
More women, those who are in a higher socioeconomic, and those that have higher education.
Lindgren and his wife have been sober for more than 6 months. They're now focusing on their newborn and getting their other children back.
The feeling was emptiness, regret, failure, and to be there for your children.
In Phoenix, Sonny Scott, Cronkite News.
A recent Pew report ranks Arizona as one of 6 states with the fewest options for people addicted to alcohol and drugs. Nevada, Georgia, Texas, Indiana, and Florida also fall short, even as addictions of prescription pills and heroin continue to increase among young adults.
Josh Martin just opened a treatment center in Tempe, where he says he saw a great need.
We opened up right in the heart of where we think the problem is.
The Pew report shows Arizona having only 20 treatment facilities per 1,000 addicted adults, compared to the national average of 32 centers per 1,000 addicted adults. When I spoke with professionals around the valley, they all had about the same response. They were not surprised.
I think the report is nice data in general, but all the people that work in the profession knows there is a need.
Ihab Abdallah with Banner Health said they saw this problem a long time ago and are working towards a small but hopefully substantial step to expand.
Overall, the system will have about 60 or 70 more beds. I know from working in the community in general that I think other facilities are expanding.
Heroin?
Last year, Cronkite News documented Arizona's heroin epidemic, triggered in part by the growing use of prescription drugs.
And then next thing you know, you're spending $300 a day on pills. So the natural progression is to go to the heroin where you can get it for 10, 20 bucks a day.
The Arizona Department of Health Services says having a provider issue is nothing new.
You know, statewide, with all types of providers, Arizona, it does face a provider shortage.
But Scott Bartlett with Banner Health said having enough beds isn't the only solution.
Family members would be able to recognize symptoms before they got out of control. Sometimes friends and family are reluctant to step up and tell the person that they think that there's a problem because it'll create a conflict for them.
The states with the best ratio of treatment centers to addicted adults, according to the Pew report, are Maine, Connecticut, and Vermont. For full multimedia coverage all week, check out our website at cronkitenews.azpbs.org. With the investigative team, I'm Sydney Glenn, Cronkite News.
As part of our continuing commitment to track heroin's hold on Arizona, Cronkite News has been examining the state's major drug trafficking routes and what law enforcement officials are doing to stop smugglers. Cronkite News reporter Sonny Scott looks at efforts in Pinal County, a major drug corridor.
A 2015 intelligence report from the Drug Enforcement Administration says western states like Arizona continue to be primary transit areas, and even more traffickers are moving their operations into suburban and rural areas like Maricopa and Pinal County. From one end of Arizona's vast desert landscape to another, drug smugglers continue to move more heroin and methamphetamine than they ever have, right into the hands of drug dealers and addicts. Law enforcement authorities are patrolling Arizona to stop it.
196, I copy.
2 extra, 1 team traffic.
And Pinal County is on the front lines of the fight.
It seems that over the past couple years it's really picked up, just from what you see and what you hear.
Chris Platt, a detective with the anti-smuggling unit in Pinal County, spends his days with other detectives doing smuggling-based investigations and drug interdictions on Interstates 8 and 10. Here in Pinal County, drug traffickers sometimes call 911 to report a fake accident to divert law enforcement agencies from the drug routes, just like here on Interstate 10 towards Phoenix.
We're dealing with more the aspect when it gets picked up from already traveling through the desert on one of the interstates, and then it's going through Pinal County up to Phoenix.
Numbers obtained by Cronkite News from the Phoenix Division of the Federal Drug Enforcement Administration show more than 576 kilograms of heroin were seized this year. That's up from 163 kilograms found in 2010. This year, over 2,900 kilograms of meth were seized, compared to 730 in 2010.
Pinal County borders Mexico, and it also encompasses the Tohono O'odham Indian Reservation, which is sparsely populated, creates a lot of opportunity for the Mexican cartels to exploit that vast desert area to bring the drugs into the country.
After traveling up north through Interstate 10, Phoenix becomes the hub of distribution for other U.S. cities.
We see a vast majority of the drugs being smuggled through the Midwest and the states and cities there.
These headlines document the scope of the problem from Idaho to Texas, North Dakota to Indiana, and all across the southeastern United States.
We're starting to see the Mexican heroin going into the northeast, and the Midwest, which are the primary markets for heroin.
The Arizona high-intensity drug trafficking area brings various law enforcement agencies together to work as a force.
HIDE is doing a couple different things. Our enforcement initiatives, our task forces are concentrating on heroin, doing the investigations and trying to put the bad guys in jail.
They'll slip it over their shoes and tie them around them. You know, the carpet makes it tough to track.
Platt's main goal is to stop the deadly drugs as they move through Pinal County and the rest of the country, keeping heroin and meth out of the hands of smugglers and addicts. Deaths involving heroin overdoses are rising in the state, according to the Arizona Department of Health Services. Fewer than 50 people died in 2004 compared to nearly 200 people in 2014. With the investigative team, I'm Sonny Scott, Cronkite News.
Earlier this year, the Cronkite News Heroin Project exposed the recent epidemic of heroin use across the state. A national survey just last year said heroin use in women between the ages of 15 and 44 jumped from 83,000 in 2012 to 109,000 in 2014. Even more troubling is that some of those women are using heroin and other illicit drugs while pregnant. Every day, Dr. Nathan Lepp treats babies in neonatal intensive care units across Phoenix. Some of them are unwillingly addicted to drugs.
This is a burgeoning epidemic that really has just happened in the last 5 to 8 years that all of us who take care of babies are just now really dealing with every day.
According to the Department of Health Services in Arizona, the rate of newborns exposed to narcotics has increased more than 218% since 2009. Christy Arthur was pregnant, addicted to meth, and unable to stay sober. That's when she turned to a recovery program for addicted pregnant women in Phoenix.
Honestly, I came in because I wanted to just stay sober long enough to have my baby.
Dana Neves, also addicted to meth, checked in at the same time. She didn't know where else to turn.
I never wanted to be pregnant and use a substance. I never thought I would be that kind of a person.
Angela Phillips with Community Bridges Center for Hope works closely with these women and sees the emotional toll.
They feel that they've hurt their baby, their baby's gonna come out with problems and it's all their faults, and now they're fighting not only their previous problems and concerns that possibly started their addiction, but now the concerns of what have I done to my baby.
The women are put on special treatments to kick the addiction. Common detox drugs include methadone, buprenorphine, Subutex, and Suboxone. The Center for Hope uses a methadone treatment program, but that doesn't alleviate the risk of the infant enduring withdrawal symptoms.
A lot of the women who are on methadone and they go to give birth to their baby's going to experience withdrawals.
When babies are born with neonatal abstinence syndrome, they end up in the NICU, where they can remain for an extended period of time.
In a baby, we're looking for signs and symptoms that include inconsolable crying, vomiting, diarrhea, shaking. It can even go so bad as to be seizures.
But neonatal abstinence syndrome is not the only risk these newborns face.
There's really lifelong effects that can affect the child after delivery. So things like cognitive delays or developmental delays, social delays, behavioral problems.
Arthur, a mother of 6, experienced the devastating effects on her children.
I mean, there's a lot of factors that will say, yes,
my kids did have side effects from my using.
Arthur says she's put the past behind her.
I'm in a good place. I've been sober for 9 years. January will be 10 for me. I have a really good job. I have a stable house. I'm married. My kids know that I'll be home at night.
And so has Neves.
I now have my bachelor's degree. I'm a director in the position that I work in. I cleaned up my credit. I bought a house. I got married. So now I have, the traditional family, the mom, the dad, the 3 kids, 3 dogs.
According to the 2014 National Survey on Drug Use and Health, over 120,000 women admitted to using some type of illicit drug while pregnant.
That's it for this special edition of Cronkite News Tonight. Thanks for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.
Are you a news junkie, history buff, science or nature lover? Then discover 8 World, an entire channel devoted to bringing the world home to Arizona. Watch 8 World on Cox 88 or over the air via antenna on 8.3. To find out how to tune into 8 World through your satellite or another cable provider, visit azpbs.org/world or call 602-496-2308. Discover your world. 8 World.
See this flower garden? There used to be a car sitting there, a car I didn't use and didn't want. So I donated it to public television, and they took care of everything. In addition to supporting my favorite programs, I earned a tax deduction. Turn something you don't need into something you really want. Contact the Vehicle Donation Program.
8 is Arizona PBS, a service of Arizona State University. Get the inside scoop on what's happening at Arizona PBS. Become an 8 Insider. You'll receive weekly updates on the most anticipated upcoming programs and events. Get the 8 Insider delivered to your email inbox. Visit azpbs.org to sign up today.